Hello everyone. Today, we're exploring the medication known as Vanos, which is a brand name for the generic drug fluocinonide. As always, this discussion is for educational purposes. If you have health-related questions or concerns, it's essential to consult a medical professional. Description: Vanos, whose generic name is fluocinonide, is a potent topical steroid. Its primary function is to prevent the release of substances in the body that cause inflammation. Vanos is primarily used to treat inflammation and itching caused by plaque psoriasis or other skin conditions that respond to steroid medication. There may be other uses for Vanos that aren't listed in this guide, so it's always best to consult with a healthcare provider for specific indications. Side effects: like all medications, Vanos can have side effects. Some of the common side effects include burning, stinging, itching, or dryness of treated skin, redness or crusting around hair follicles, stretch marks, spider veins, acne, lightened color of treated skin, headache, stuffy nose or sore throat. More severe side effects can include redness, warmth, swelling, oozing, or severe irritation of treated skin, worsening of the skin condition. Signs of absorbing Vanos through the skin, such as weight gain, especially in the face or upper back and torso, slow wound healing, thinning or discolored skin, increased body hair, muscle weakness, nausea, diarrhea, tiredness, mood changes, menstrual changes, and sexual changes. It's crucial to consult your doctor if you experience any unusual or severe symptoms and to be aware of potential side effects. Warnings: before using Vanos, it's essential to inform your healthcare provider about any allergies, medical conditions, or other medications you're taking. Some considerations include any type of skin infection, previous skin reactions to steroid medications, liver disease, adrenal gland disorders, diabetes, as steroid medicines can increase glucose levels. Furthermore, it's not fully known whether Vanos can harm an unborn baby, so if you're pregnant or planning to become pregnant, consult with your doctor. Breastfeeding mothers should also discuss potential risks with their healthcare provider before taking this medicine. You should not use Vanos if you're allergic to it. It's essential to inform your doctor about any skin infections, reactions to other steroid medicines, liver disease, adrenal gland disorders, or if you have diabetes. It's also crucial to discuss any plans for pregnancy or if you're currently breastfeeding. Some forms of this medication may not be suitable for children under 12, and children can absorb larger amounts of this medicine, potentially leading to side effects. Dosage: always follow your doctor's instructions and the directions on your prescription label when using Vanos. This medication is for topical use only and should not be ingested. Avoid using it on open wounds or irritated skin. A thin layer should be applied to the affected area, and it's essential not to cover the treated skin unless directed by a doctor. If treating the scalp, apply the medicine directly and allow it to dry thoroughly. If your symptoms don't improve after 2 weeks or worsen, contact your doctor. Avoid: while using Vanos, avoid getting the medication in your eyes. If this happens, rinse thoroughly with water. It's also advisable to avoid applying Vanos to your face, scalp, underarms, or groin area unless directed by a doctor. Do not use Vanos to treat any skin condition that hasn't been checked by your healthcare provider. Interactions: while topical medicines like Vanos are less likely to interact with other drugs, it's always best to inform your healthcare provider about all medications, supplements, and herbal products you're taking. FAQ: is Vanos an antibiotic? No, Vanos is not an antibiotic. It's a high-potency steroid typically used to treat conditions like psoriasis, eczema, or dermatitis. Is Vanos safe for children? Some forms of Vanos may not be suitable for children under 12. Always consult with a healthcare provider before using it on children. Closing: that concludes our overview of Vanos. As always, this information is intended for educational purposes and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for joining us.